Perez. I'm a graduate student majoring in electrical engineering here at the University of Arizona. During the summer break, I'm participating in the Summer Institute Medical Ignorance Program, and I've been working in Dr. Russell Witty's lab.
Dr. Witty's lab, referred to as UNL, Experimental Ultrasound and Neural Imaging Lab that is, focuses on using sound as a non-invasive and robust medical imaging method. Our lab seeks to answer the question of how we can use hybrid imaging modalities to more accurately diagnose patients and improve treatment decision-making. Vibrational potentials are created when a pressure wave, like an ultrasound pulse, creates a temporary dipole in the ion surrounding, in our case, an electrode. This in turn temporarily creates an ionization electrical potential observed as voltage, which can be read by the electrode, thus giving us a vibrational potential signal. Vibrational potentials can be used in the imaging of electrodes in the human brain. For a variety of neurological disorders like seizures, deep brain stimulation is a common treatment used. After a neurologist determines exactly where the electrode arrays need to be placed, a procedure is performed. It is important for the patient's health and recovery that these arrays are placed in the precise location they were intended for. This verification can be done during or after surgery with a variety of imaging modalities, but most commonly computed tomography or CT. However, these machines can be bulky and expose patients to ionizing radiation, which must be avoided. Ultrasound vibrational potential imaging offers a modality that is low cost, safe to use, and can be used during or after a procedure. For example, by placing an ultrasound transducer against the patient's skull, ultrasound can be pulsed to the skull in order to oscillate ions surrounding the electrodes in the array. This creates a voltage potential that can be measured from the electrodes themselves. Last summer, I was able to collect vibrational potentials in a simple saline tank setup. However, the question this summer was, is it possible to record ultrasound vibrational potentials with a thick skull in between the ultrasound and the electrodes? And will these potentials have comparable amplitude to vibrational potentials when the electrodes were in a saline tank? The experiment to answer this question was as follows. We had 8 needle electrodes encased in an agarose and saline gel inside a skull cap. We had the skull cap set up such that the ultrasound probe could be coupled with the skull with ultrasound gel. In photos shown, you can see gold clip electrodes covered with tape placed on the surface of the skull. These were used to record a different signal than ultrasound vibrational potentials. The needle electrodes were the ones recording voltages when we pulsed the electrodes with an acoustic wave from the ultrasound transducer, which had a center frequency of 0.6 megahertz. As of the making of this video, I have not been able to look thoroughly through the data collected to fully answer my summer research question.